Welcome to our latest episode of the Lebanese Physicians Podcast. And today, this episode's co-host is Mohammad Ali and our guest is Dr. Firas Mahdi. And we will actually be from LEK Consulting. And today we will be discussing strategies in healthcare and technological strategies in healthcare, East meets Middle East. That's Firas's version of the title. Welcome, Firas, to the podcast.
Thank you for having me. Thank you both. I'm looking forward to the conversation.
Firas, can you give us just a brief background on what you do currently in Singapore?
Sure thing. So I've been in Singapore for 7 years. My current job is I'm a partner at LEK Consulting, which is a global strategy firm. Some of the benefits of this is I work in the healthcare practice, which is almost 50% of our work at the firm globally. So it's a very healthcare-oriented firm. We work across pharma, MedTech, healthcare services, payers, providers, consumer healthcare, you name it. And we advise both public and private sectors.
Excellent.
Amazing. So you actually started your medical training in Lebanon and then moved to the Gulf, and now you're in Singapore. I'm kind of jealous of your progression. So how did you exactly end up in Singapore? Tell us more about that journey.
Well, without giving you the autobiography version, yes, I was been very fortunate. I think that's the top headline. Providence played a big role in this, the entirety of it. I did train at AUBMC, so I was very privileged to have had a good, education, medical school at AUB. I think a pivotal moment happened prior to my residency in internal medicine, which was also at AUB. Between that and graduating, I did an MBA. So I got a scholarship to go to Cambridge, where I studied the Judge Business School. And I think that year was quite transformative for me, if I had to track things down. It equipped me with a different mindset, I'd say. A very different mindset that I've been accustomed to growing up in Lebanon. And I got to apply it relatively quickly. At AUB, I was like president of the RSO. So I kind of applied business model thinking to the resident staff organization. But I was, again, fortunate. I practiced within like 1 year of practicing medicine in Riyadh. General Electric reached out to me, and they were building a consulting arm. And I got the chance to join forces with them. And their consulting arm was working on large-scale transformations, healthcare performance improvement across the GCC and other growth markets. And I worked for them for many years. I also worked at Medtronic, which it's a major player in the MedTech space. I started working with them in the Middle East initially. And this is on the also consulting arm, if you'd like. So GE had a consulting arm, Medtronic had a consulting arm, and they were looking at large-scale investments with their clients, long-term client commitments in return for strategic and operational kind of consulting work. And I did that for a number of years as well before I got the opportunity to come to Singapore with Medtronic as well. And I think that was a pivotal moment too, making that decision to say, I'm leaving Lebanon, I'm leaving the culture I know, and I'm going really far east. Singapore's far across the horizon, if you want. And I was very lucky. I ended up doing internal consulting for Medtronic, and then given, what consultants say, put your money where your mouth is. I was given the keys to a business, and I was asked to turn it around, which was just an amazing experience. After that, to history, I went back into purist consulting with a company called IQVIA, where I established their MedTech practice in APAC. And then I joined LEK a couple of years ago as a partner. So it's been very rewarding. I say, again, I would have loved to tell you that I kind of had this architected in my mind. In my business school application, I did say I want to become a consultant and one day a partner at a consulting firm. I can tell you with full confidence that I said that because I thought it sounded right. No indication that I would find myself where I am today. So convergence of luck. So alhamdulillah.
Yeah, I think luck and maybe right connections. I think a lot of this is also like emotional intelligence, EI, and then maybe, do you think the MBA has helped you quite a bit in this journey?
I love your question. It's probably one of the oldest questions, most contested questions, like the value of the MBA. And in terms of content, well, let me say this. I was fortunate it was an MBA designed for life sciences people. So this was a pilot, it was his third year running, and was very focused on entrepreneurship. So I actually established a company that survived till, well, it still survives. It's called CampStent. So we were in the medtech space. So I learned hands-on quite a bit. But in terms of the content, I think it is important, but the network helps a lot. So I won't deny I've had the virtue and the fortunate, circumstance to meet a lot of alumni who have opened up doors. I've opened up doors for alumni, and that's how it works. Same thing about AUB. AUB is quite it has a large alumni network, and when alumni help each other, it's quite impactful on people's lives and their careers.
Yeah, it makes sense. It's all about like opening yourself up to opportunities and to networking and making yourself available. I think that's the value of the MBA course.
Yeah, I think that's one. But I have to also admit that I got a training throughout my career. So GE, for example, is like the first case study you learn in a business school. It's about General Electric. And when I got management training there, I remember one of the senior vice presidents coming in, and somebody asked him, like, what is a pivotal mindset that made you successful? And he said what you just said, Mohammad Ali. I said yes. I had an open mind. When they said, you want to go to Japan? I said, okay. You want to go back to Russia? He said yes. And he got this international exposure by being open to the possibilities. I think that's a very key learning I've imbibed, at least.
Awesome. So you've worked at a lot of like the big names. Your resume, mashallah, you've worked at a lot of the big names. So can you talk to us more about like the medtech space, and maybe we can talk about like the differences between like the Gulf, Saudi, Dubai, and more Singapore. And maybe if you want to talk to our audience a little bit about the Singapore healthcare model. A lot of us are biased toward Northern Europe and Western Europe and Northern America, but don't know much about Singapore. So can you talk to us a little bit about that?
Sure. In fact, let me tackle the first one, like in medtech space. So what medtech maybe means a lot of things, and people cut it up in different ways. Medical technology, oftentimes it's medical devices and manufacturing, obviously with the rise of things like digital health. Where does that lie? Oftentimes it lies within the medtech space. Telehealth has a lot of medtech incorporated in it, wearables, even the kind of platform solutions that bringing data together, that oftentimes is categorized as medtech. And the medtech space is vast. It is slightly different than the pharma, well, actually quite different than the pharma space, where the barrier to entry is very, very high. You can't just willy-nilly create a concoction and say, here you go, I'm going to sell it to you. However, in the medtech space, you can design quite a bit, and you can improve on predicate designs. So there's a lot of room for creativity in the medtech space. And that is in the sheer number of pharmaceutical entities, like molecules and treatments, versus medtech space. There's an order of magnitude difference. It's a very different place. As to Singapore, so Singapore, I think I've been fortunate living here for 7 years. It's often ranked as one of the most efficient, one of the best healthcare systems on the planet. They have probably, I think, the highest life expectancy as well. There was this show on Netflix, The Blue Zones, where they were trying to highlight why people lived so long. And Singapore, I mean, there's often some ethnic or racial genetic predispositions, but it has taken care of its people as an art form, truly honest. I think there are stark differences in the way it functions. It is not pure capitalist, even though it functions very well in financial services space and capital markets. It's a powerhouse. It's one of the Asian tiger economies. But in the healthcare space, it kind of combines both open market, and kind of paternalistic government spending. And it's done so in a the model here is very successful. And what's interesting about it is it continues to evolve. So they've introduced capitation models now. If you live in Saudi Arabia and they have this cluster model going on in Saudi, the cluster model pioneered a long time ago in Singapore, and they had few clusters, many clusters, brought it down now to 3. They're trying to integrate them a bit more. So there's always this continuous evolution that they're going through, step by step. But Singapore is just one model in Asia Pacific that I've seen. So you have Japan, South Korea, Thailand, Vietnam, India, Australia. Each one has its own idiosyncrasies. If I can take one message is build a system that's good for your people. Singapore also has its own parameters that are very different than everybody else. It's a small island, 650, 700 square kilometers, not very big, limited population, and very, high trust in government, et cetera, maybe very different than China or Japan, South Korea.
Right.
I mean, they're doing something right.
Well, they're doing many things right. They're doing quite a few things right.
Yeah, and I think each country has its own like healthcare model, and I mean everybody wants to try to reach the ultimate or the perfect healthcare model. And I know it's hard, but it looks like Singapore is getting close to that, I guess. And would you compare it to like the Swiss healthcare model, where you've got a public-private sector involvement in healthcare?
I mean, there are going to be similarities. 20 years ago, I did my thesis kind of compared GCC, nascent economies at the time, were very rapidly developing, versus Singapore, and looking at kind of the genealogy. And a lot of the GCC was trying to blueprint itself based on Singapore, but Singapore itself had blueprinted itself off Switzerland. So there's that kind of family tree going on. But that being said, Singapore doesn't have the cantons that Switzerland has. It doesn't have that much distinction between federal and canton kind of governments, that tension there. And also, it is, single party, long-term vision, very strategic in the way it does things, and can do things, I wouldn't say by fiat. It's a democratic society, no question about it. But it has the benefit of having, a dominant major political force that can just move things in a very clear direction. I think that's something that sets it apart. But there are definitely similarities in terms of the private-public aspects of it. I think what's really nice about Singapore is that while it attempts to achieve, for example, universal health coverage, it doesn't do so like a blanket statement. It says the population has to be socially responsible in its usage of the healthcare services. And it's a clear thing. The more you consume, and people could assume that healthcare is like this infinitely elastic space where you can just keep on consuming healthcare until the kingdom comes. And many people do. They have good insurance. They keep on doing tests. Singapore tries to eschew that model a bit. They put a lot of onus on social responsibility, and the population accepts it. And that it's also fiscal. So you pay something. It's subsidized, but you are paying something. So that is a bit of a deterrent as well. Yet it works. Best life expectancy, and people are not being turned away from hospitals. People are getting probably some of the best healthcare in the world.
Right. And we've noticed that you've led projects. This is a good segue into this, on hospital performance transformation and value-based healthcare. Can you share one example where you saw measurable impact?
It's a good one. There are many, but I don't have to think about the one that strikes, well, that lives in my memory quite a bit. So this is in a GCC country, and we were tasked early in a ministerial transformation project. We had a large flagship hospital, and this hospital specifically had a problem in its dialysis unit. And we had to do root cause analysis and what have you. And we looked at why is the average length of stay for an AV fistula, for example, was 19 days. And, we jigged the system. An AV fistula is a 1-day thing. It's a day surgery. Why 19 days? What kind of waste is going on there? And I think that was something that, it was early in my career, but I saw it immediately. And this was early, and it helped me also validate my move from doctor to consultant in many ways, because I got to see it live. Patients not spending 20 days, almost 3 weeks in a hospital waiting for a procedure, literally doing nothing, consuming a hospital bed. So I think that for me was one, it was one project amongst many within that hospital. But that same thinking, I got the opportunity to do across like 70 hospitals at once in a giant transformation project within Saudi Arabia, for example. So, I mean, impact comes in many ways and forms in this space. And I think, especially when it comes to the patient, it sticks in your mind.
So no regrets on leaving clinical practice, eh?
Let me be honest. There's nothing like helping a patient. There's nothing like it. Okay, this is the most noble profession, and I'm not going to be the guy telling you, no regrets. I'm happy where I am. Of course, any good doctor would tell you, they miss their patient kind of interaction, and there's a satisfaction that you will never get that resembles treating the patient. So, which is the reason why I gave that example. It's probably the closest one.
Fair enough. Fair enough. And so in your role now in consulting, where do you see the best use of MedTech right now? Or do you think we're transforming more into AI and there's going to be, I guess my question is, how do you see the impact of AI on MedTech? Will it take away from it or will it give it more?
In the MedTech space specifically, it can only give more. That's taking AI in isolation. In the medical technology space, so you can imagine your large capital equipment like the CT scans, MRIs, they already have AI. There's some element of this. Your EKG is they're getting more sophisticated at reading the actual output, right? The stuff we had to study and memorize is now being, click of a button can analyze it for you. And that's normal. The next iteration in MedTech is harnessing a lot of the data that goes underutilized or unutilized completely. So a lot of these are machines, right? This is very different than pharma, right? Where it's a prescription. These are machines and they have a lot of metadata, a lot of log data. How can you best use it? And there have been experiments galore from, reading CT scans during COVID. Singapore's quite successful in that. X-rays actually. To how do you combine multiple sources of data, so different machines? How do you combine that now with, reasoning or certain metrics from that EMR? Can those be pulled, combined? Predictive analytics has been a long-term thing mentioned. The interoperability is something that is improving, albeit through third-party systems rather than, foundational, making sure everybody follows the same rules, which I think is an impossibility, especially in the day and age of AI where things are moving at a breakneck pace. Other effects on MedTech will probably be in regulations. So MedTech, like anything else in healthcare, is extremely regulated. It is the healthcare authorities, the FDAs of the world, have their task cut out for them just to maintain, how do we assess all this, especially now since a lot of it's black box analytics. It's very difficult to understand. And I've seen that even earlier, like maybe 6-7 years ago, if you wanted to launch a product that had a software that was relatively AI-based, or machine learning based, and you wanted to update it, and the updates relatively quickly. By the time you get the third or fourth update, you would have finally approved the first one through the regulatory authority, which is ridiculous. Just highlights how slow things are. But again, they're adapting. If you want to talk about the AI in the healthcare space in general, that's probably also a conversation we could have.
Go ahead. I'm all ears.
Sure. I started off, 3 years ago, at least 4 years ago, saying that the human must be, consistent in this, in the loop of healthcare provision. And I still think so. Despite many, many articles coming out, the Lancet saying, they do head-to-head between a chatbot, an earlier chatbot, and physicians blinded. Patients somehow found the chatbot more empathetic than patients, which was for me a moment in time because I had always run with the hypothesis that patients prefer the human touch. But again, looking at the design of it, patients still like the human touch. Once they realize that it's an AI, a lot of that falls apart. So when they're blinded to it, there's some benefit. But when they know they're speaking to a non-human, a lot of the challenges that have long, plagued patients, they want to see a doctor. They want to sometimes just talk about stress and life and what have you. And you know this, I'm sure, very well, both of you. It's stress is the root cause of half your diseases. I don't know if there's a statistic to it, but I know for a fact my patients, we talk about their diabetes for a minute and then about the rest of the 10 things that are bothering them. Will AI cut the human out of the loop? I don't think so. How will people adopt AI in their day-to-day, seeking of medical attention? That is evolving. So I'm not fully in the camp that it's 100% going to be humans. I think people are getting far more comfortable with speaking to a in silico. How will that affect us? Many, many different ways. And I think it's prudent for anybody in the healthcare business to take a pause and see, if I'm doing an AI initiative, I'm launching something, how will it affect the doctors, the patients, the overall system? I give you one example. So a large-scale private clinic chain, very happy, launching a lot of AI to improve productivity and efficiency for doctors, which makes perfect sense. That's the easy, low-hanging fruit use case. But when you speak with them and they're telling you, well, I need to do this, and I'm very happy, I'm going to make my doctors more productive. They're seeing one patient every 6 minutes. I can improve on that. You have to ask yourself, is that the right way of using AI? It's making us all into machines. So I think there's all philosophical arguments you can have on the AI front in terms of healthcare service provision. Someone's going to be net positive, someone's going to be detracting. I think.
Yep.
Worthy of pause.
Yeah, I mean, my opinion. I'm going to say my opinion. I think it's going to improve the provision of healthcare by maybe making it more accurate and more efficient. I mean, of course, there's ups and downs with it, but my opinion is not going to replace doctors completely. Just because, as you said, I think there's a huge importance on a doctor-patient relationship and patients being able to talk to people and not necessarily to a chatbot.
Yeah. Even if they're saying the exact same thing, I think once people realize that that's not real, they have a bit of a moment.
Right. So as a segue from your work or time at LEK Consulting, what's one project that really pushed the boundaries of how data and technology can drive better outcomes?
Well, one of the sometimes as consultants, we give advice, and sometimes it's over a few weeks, sometimes it's over a few months, maybe a year or two. And measuring outcomes is a bit of a holy grail in healthcare. Rarely are you able to do the long-term outcomes. I think one thing in the data space, early in my career or mid-career, was command center building. This was at GE. We were able to harness a lot of data elements and put them together. I think that was something, it has grown into a massive franchise for them. They built these NASA-like command centers where data across the healthcare system is just funneling in, and they're able to kind of traffic control it if you want. I think that's a lot of benefit. And we're able to see that in real time. I think at LEK, where we focus a lot on strategy, one of the biggest challenges is data, and data as a substrate in anything, in digital health and in AI and ML, whatever you want to call it. And a lot of the challenges are business model limited. Data is not freely available. And I think with this one interesting article was to do systematic reviews across the entirety of human knowledge via OpenAI or ChatGPT or whatever model they were using, and they compared it to your classic systematic review from human researcher. It did an okay job, and not an excellent job, because a lot of the best papers were behind paywalls. So there's elements here where maybe truly harnessing data, and as I said, MedTech, they own their own data, hospitals own their own data. It is quite fragmented, and giving strategy around monetizing data, making it exchangeable, making it something that you can trade off. I think that's been quite rewarding, because you can see all of a sudden, okay, this is accessible. It's not just my data, your data, and everybody do their own thing. You do have to create those exchanges and platforms. So I think that's been quite rewarding.
Right. And one thing, so I'm going to have Mohammad Ali ask you that question about the Singapore and the Middle East. How do you compare? Do you want to ask him, Mohammad, since you're in the Middle East?
Yeah. I mean, I guess we started talking about it. Firas mentioned how a lot of the benchmarking in the Gulf was compared to Singapore, right? Because you're comparing different systems in the world, right? So in the UK, for example, you have a single payer system, the NHS. In the US, it's super fragmented. And then you have the good public-private partnership in Singapore. And I guess you were talking a little bit about how there's a lot of like responsibility on the citizen to take care of their health, as opposed to somewhere in the UK where all the burden is on the government. But I'd be interested to hear more about how the Singapore healthcare system achieved that now in the private public sector, and how they're using like technology and all the new advancements to advance their healthcare system, as opposed to what we're seeing in the US, where all those advancements are just a burden on the system and it's just becoming too expensive to take care of people. So how do you achieve that balance, I guess?
I think it's a hard question, because some of the assumptions here is that somehow Singapore has achieved the balance. It's a very good healthcare system, but like many other economies in Asia, it's also heading toward what we call a silver cliff, or a silver. It's people are getting older, and the proportion of the population that's above 65, 68 is getting higher, which means who's going to pay for their healthcare? Who's going to subsidize that? What kind of tax money is going to help there? And yes, you're right. GDP, and from a GDP point of view, percentage spent on healthcare expenditure on healthcare is very different than the US. The US is in many ways disastrous, to be frank. It's spending across the board, but workforce shortages, increasing costs also affect the Asia Pacific economies. I think there is quite a focus on looking at new value-based healthcare models, and not just the general. The value-based healthcare is a term that is mentioned across the globe. Started off through Michael Porter many years ago, but thinking about payer, provider, private, public ways of doing business a bit better, I think that's important. I think harnessing a lot of operational efficiency is important, but also making sure that the outcomes are not just the greatest new tech and just pay for it. A lot of the APAC economies will ask a lot of questions before they offer reimbursement, or allow the product to be, or treatment therapy allowed to be in the country, because free market has a bit of a cap to it. Otherwise, it's just fee for service, the coolest, greatest, charge what you want, hallelujah, and spiraling costs through the roof.
That's correct.
You know this probably much more than I in the US, how it's structured there.
Yeah, I mean, right now there's a lot of problems with the healthcare model here in terms of, like, of course, rising insurance costs, like extremely rising, and then at the same time, severe shortages of healthcare workers across the board. I think that's a model you want to try to improve and maybe make it work for everyone.
Yeah, I wouldn't embrace it. I mean, the countries that don't have it already should not embrace it fully. Singapore, ironically, I mean, it has a private sector that mimics in many ways what you have in the US. So it's a parallel. The pure private sector, very expensive. Insurance premiums growing 25, 30% year on year. So it has all the same symptoms.
Right. But yeah, I think it's hard to get the perfect model, but probably you want to try to get the most perfect one that can at least cover most of the people in your country. I think that's what.
Yes. Yeah. It has to be tailor-made, of course.
Right. So I think we've spent a lot of time. I mean, it's always like we can keep talking about this topic for a very long time. But my last question for you is, looking back at your journey, right? I would call this a global journey. You've been everywhere, clinician, industry leader, strategist. What would you advise and tell your younger self about building a career with purpose? And also, what would you advise young people at this point who are trying to pivot out of clinical care? What's your advice to them in terms of doing that?
Yeah, let me start with maybe the second question. For young professionals to want to leave, one might embark on consulting or a non-clinical career. Did I get that right?
Yeah.
Okay.
No, Khalil, I'm left with note.
I think everybody has a set of circumstances. If you're doing it for the right reasons, you can take a long look in the mirror and why do you want to change? Is it, I don't like my current, what I'm doing, my current job, maybe not my current career. That's a different question altogether. And I've had a lot of moments where I've coached physicians or clinicians or PhDers who have asked me those exact same questions. And I would be very cautious in giving them kind of a blanket. This is what you need to do. And every circumstance is different. I think if anything, you're very self-reflective and introspective. It's not necessarily greener on the grass is greener on the other side. If you start off new, you're starting off as an intern. I remember moving when I transitioned. My boss at the time said, for us to understand that you're starting your residency from scratch, you're not going through a consulting career. It's a different set of skill sets, though there were many skill sets that were transferable. A doctor's called a consultant too, because they listen to the problem. They have a problem saying, they listen to the history, they do some tests, have a hypothesis, test it again, and then give recommendations, which is in many ways, if I say, not to simplify too much, but similar to what a consultant does. So I found that, I was able to leverage that quite a bit. I also can say that the world has changed. So you'll find, not to overhype it, but AI is doing a lot of things, especially the LLMs, the ChatGPTs. They do quite a lot of things that, your first year, second year analysts do in consulting firms, even maybe associates. They troll through huge amounts of data, reports upon reports, and can synthesize and summarize quite quickly. Things that would take 2-3 weeks done, in the blink of an eye. So that space is changing. There's a lot more. There's a lot of other things that that they can adopt, they can do, but they have to keep an eye on the market. So I wouldn't be blanket about it. In terms of my younger self and how to be impactful, it's a hard question. I think being more open to doing things and impact is maybe a big word. Impact doesn't have to be changing the world. I think also maybe utopian thinking is something that is good and bad. Have big ambitions, but also be happy with the smaller wins is something I tell myself. And I think that would help a lot in terms of where you want to put yourself, where you want to position your own career. Not everything has to be, I'm going to eradicate TB or HIV in Africa, or what have you. Impact can be very small. It can be patient by patient, can be healthcare systems, can be small change that impacts a lot of people, and keep that in mind. So oftentimes you are impactful, but you forget what you're doing, and then you lose sight of why you're doing it. I think I would give that, consistent reminder. I remind myself today, same thing. Makes sense.
Deep words, words of wisdom. يعني ما شاء الله عليك. يعني you've had quite the journey. I think a lot of our listeners will find it inspirational. So a lot of people looking for opportunities, maybe outside of Lebanon, it's good to know that there are options besides Northern America and Western Europe. Maybe look east and not just to the Middle East.
Oh man, 60% of the world's population. Right. Is this part of this part of the globe?
Right.
Yeah, so keep an open mind, I guess, and be open to all opportunities. And there's a lot of careers to explore outside of medicine. So thank you for sharing your experience and words of wisdom.
My pleasure. Thank you both for hosting me. I found this very funny.
And I'm just going to end it with one thing. I think what you were saying, the 60% of the world population, I don't know if you guys have read the book Factfulness by Hans Rosling. He wrote about actually East Asia and how it is the next actually economic powerhouse just because of the population and the growing economies in the area. We always forget about it, but I think that's the growing part of the world right now.
It is. I mean, in terms of GDP, we have maybe 3 out of the top 5 economies. Population, as you said it. I'm not familiar with that book, but definitely the bipolar world from geopolitics point of view is clearly in front of us these days. We're feeling it. We're in influence of both. We have American MNCs, we have China next door. It's all good. I mean, It's a great place to be.
It is, exactly. All right. Thank you, Firas.
Thank you, guys. Bye-bye.